morning, I'm Becky. We're going to train on indirect bonding. We take the patient napkin and we wet the center of it just so that when we clean the teeth off, it doesn't spray all over the patient's mouth. Tear in a hole in the center, place over the patient's face like so. I'm gonna hook up the sandblaster and just continue clean the teeth off. Continue that on upper and lower. Indirect bonding trays come in a container like this. Before the patient arrives, you want to make sure that you open the kit and that you look at each individual bracket, making sure that the correct bracket is on each individual. After inspecting the trays and making sure the brackets are fully seated, we're going to load each bracket with bonding material. Take a little bit of the solo and adapt it well to each bracket. Adapt it to all of your brackets, place them back into the tray, and seal that so that the cement does not apply tooth retractors, isolating the patient well. Sometimes I like to add dry angles to keep the etch off the second molars in the back. Dry and then beginning applying your etch. After the appropriate amount of time of etch, rinse the patient extremely well. After appropriately drying all the tooth surfaces, apply dry angles and cotton rolls into the front of the area so that the patient's teeth remain dry. After isolation and proper drying, you apply a first Assure and then Solo. Applying Assure and Solo, disperse the product by air drying a little bit and light curing on each tooth for a few seconds to make sure that the trays don't stuck. You take your preloaded tray, remove the suction tip, apply it to the teeth, pressing firmly. And then you're able to light cure. I wanted to show you this part of it outside the mouth so you can get a clearer understanding as to what the technique is without looking into the patient's mouth. When you light cure this tooth, you want to make sure that the light is completely over the bracket. It's really important. Cure it completely. Starting in the posterior so the patient doesn't get wet. Move to each subsequent tooth. Paying particular attention to the areas that have the post. If you look in this area, the tray is undercut underneath there. In order to soften that tray, you light cure it for 2 more series, and it should soften this material so you can actually pry it off the bracket like so. The other part of it is this section right here where there is some in and outs and some rotations. Light cure it again a few times so that it softens the tray so the tray is easier to remove. Sometimes the tray is easier to remove once it is warmed up with the light. So if there's an area where the bracket is sticking to the tray, simply light it with the light. Take your instrument while the tray is soft and work it off that bracket. Next step would be to dry the patient really well again, applying the extra blue glue at a 45-degree angle, using Solo on the brush tip to smooth it out really well. Make sure it's about a 1 millimeter height above the bracket to make sure that the bracket adheres well to the tooth. And then like this.